Well, good morning. I am here with Susanna Dar, and she is a psychiatric nurse practitioner here in Bozeman. She has twins that go to Longfellow. She loves to do any type of fishing, and she grew up Methodist. Previously, we have focused more on the sort of behavioral aspects of mental health. And we have been missing a really important element of that, is that sometimes it's not just on our shoulders. Sometimes there is a medical reason that we need to get worked out. And so Susanna is here, and I'm just wondering, in your experience, when do you know that you need medications to treat your mood?
You're absolutely right that behavioral changes, cognitive behavioral therapy, dialectical behavioral therapy, these are very effective in treating depressive symptoms of anxiety, and learning to think about situations, relationships, etc. in a different way can absolutely help you change your behavior. But when your mood continues to feel off for 2 weeks, 3 weeks, even months, and you start to have other symptoms like panic attacks, isolation, negative thoughts about yourself, abnormal thoughts, suicidal thoughts, thinking more about death, feeling worthless, it really is time to consider medication. Those symptoms that I just listed, they're not normal, and they're not a part of processing a pandemic.
So once you've decided that you want to ask about medication, you want to see whether or not this is something that might be right for you now or maybe for always, how do you find a good psychiatric prescriber?
For some disorders, your primary care doctor or your internal medicine doctor may feel comfortable treating minor anxiety, depressive symptoms. Sometimes they may want, or you may decide with your doctor, that you want more of a specialist and you want somebody that really is going to take 60 to 90 minutes to sit down with you and talk specifically about your mood problem. I prefer to have a direct referral so that I know that other types of illnesses have been ruled out that can mimic mental health disorders like vitamin D deficiency, iron deficiency anemia, B12 deficiency, under or overactive thyroid, side effects of medication, specifically blood pressure medicine, can look like depression. So if I have a referral from a primary care doctor, then I know that this has been ruled out and we can move forward with looking at a mental health diagnosis.
Man, I've been tested for all of that stuff.
An internet search is usually not the best way to find a psychiatric provider. Word of mouth, asking friends who's helped them.
We know that many of us are on medication. I personally have taken an antidepressant on and off probably since college, and then on since I had postpartum after Finn was born. And so how do we know if our medication that we're on is the right dose, is the right medication, if it's time for a change?
Yeah, so that all depends. There's lots of different types of medication out there to treat a myriad of mental health symptoms. Some, which are the classic antidepressants, take 8 to 12 weeks to work. And so a lot of times this isn't explained to patients that when you take a medication, you may not feel better the next day. If you've been on the medication like you have and the provider says, well, let's just increase the dose, sometimes that's discouraging for people. But I would say don't get discouraged. Sometimes you need a maximum dose of the medication that you're on instead of switching and starting all over. If you say, well, I've been on medication for 6 to 12 months and I've tried many things, again, have a conversation with your psychiatric provider or primary care and see if there are medications that could be added on to help your medication work better, because sometimes a combination is what's needed, because the goal of treatment is complete remission of the symptoms.
The other thing that I'm hearing what you're saying is don't give up. If it's a big step to ask about medication, and then you feel like, oh, it's not working. Like, it might take a little while for it to build up, or to try some different, to change the dose or try something different. So it really can take a very long time to land on something.
This is when you don't want to go by word of mouth. You don't want to say, my friend took XYZ and did well on it, so I must do well on it too, because everybody's body metabolizes these drugs differently.
How have you kind of seen faith play a role? I could see people saying, well, if I just pray harder, if I just, if I was just a good enough Christian, I wouldn't have these problems. What has been your way of thinking about all that?
Well, one of two things. Number one, if somebody said that, I would say that is symptomatic in itself.
Sure.
Number two, I believe that answered prayers can come with God putting someone in your path that can help with your symptoms, instead of answered prayers being waking up one day and having no symptoms.
It's a new year, and it's a time for new possibilities.